Thank you, Dr. Shahzada, for the kind words of introduction, and thanks to Dr. Noel for organizing this wonderful program today and inviting me to be part of it. While we had a very interesting presentation from Dr. Faria on glucocorticoid-induced osteoporosis, and the entire session is also going to be discussing about the effects of glucocorticoids on bone. I would be discussing about the effect of glucocorticoid therapy on growth and puberty. So I'll just briefly discuss this aspect, and then we'll be discussing more about the effects on bone. So this is I'll start the presentation with a case here. This is a young girl who's 10 and a half years old, presenting with a history of weight gain since 1 year. She gained about 10 years in the last year, and when she was and she had even difficulty in climbing up the stairs, pain in the thighs, and she had increasing pigmentation over her neck and elbows since 1 year. And she gave a clear history of having inflammatory arthritis, which was not evaluated properly, and she had consulted a general practitioner who prescribed steroids, and she was using steroids intermittently for past 2 years, and mostly on prednisone that she was using most of the time. And this is a picture, as you can see very clearly, that she has appearance of Cushing's features, typical moon faces, and when you look at her blood pressure was normal. There was she had typical striae on the abdomen, and you can see that her height was 130.5 centimeters at the third centile, and her height age was corresponding to 8 years and 10 months. So about 2 years delay in her height. And her weight was 52 kgs, a BMI of 30.5 kg per meter square, and a clear abdominal obesity, as you can see on the picture, and also her waist circumference of 102 centimeters. So this is a scenario where we are looking at, and this is her other picture showing delay in puberty and this posterior cervical pad of fat. Her systemic examination was within normal limits, and a provisional diagnosis of iatrogenic Cushing syndrome was made, and morning cortisol was measured, and that was clearly suppressed. So if you look at the effects of glucocorticoids on growth, what are the major effects that we see? How do glucocorticoids influence the growth in children? These are often used in many different disorders, and they are a common cause of growth retardation in children. The growth failure can develop with or without the symptoms of glucocorticoid, other signs of glucocorticoid excess. While in the patient that I have presented here, she has very clear signs of exogenous Cushing's, but growth failure can occur even in the absence of very florid signs like this. And the postulated mechanisms to how exogenous glucocorticoids interfere with growth is because of suppression of growth hormone secretion and action, and leading to suppression of bone formation, leading to nitrogen retention, and also suppression of collagen formation. So through all these mechanisms, which have been described earlier in several different reviews, you can see that there are all these mechanisms which are described to explain for the inhibition of glucocorticoid on growth. Now, this is one interesting study which looked at the effects of glucocorticoids and on the growth hormone secretion, and what they found was that there is a decrease in growth hormone release due to increased hypothalamic somatostatin secretion, which appears to be dependent on steroid-enhanced beta adrenergic responsiveness. So this is how the growth hormone release is suppressed in children with glucocorticoid use. Now, one interesting point I just wanted to mention here was that when you're looking at assessing growth on a short-term period, then the way you assess, is called as the nemometry, which is the measurement of the distance between the heel and the knee of the sitting child, and this is considered to be a very sensitive assessment, a sensitive method for assessing the short-term leg growth. This, however, does not, I mean, when you're looking at short-term glucocorticoid use, you may be able to assess the effect on growth by this with this parameter, while the final height may not be influenced in every child who's on glucocorticoids for a small period of time or on a low-dose glucocorticoids. But somebody who's got who's been on a higher dose would definitely have a significant impact on the adult height. Now, what are the different aspects about glucocorticoid use that influence the growth? So the dose of glucocorticoid that is used, the duration and potency of the steroids that are used are major factors which influence the effect on growth. The potency of dexamethasone and betamethasone in suppressing growth has been shown to be nearly 18 times higher than that of prednisone. So lower potency agents like hydrocortisone and prednisone should be used in children wherever possible. So having said that about prednisone, what we also see is that between prednisone and hydrocortisone is better. I'll just show you some evidence for that also. But if you look at growth, I mean, the influence of corticosteroids which have longer duration of action, they have a more pronounced effect on growth, and also those which are, and when you're administering it daily as compared to alternate day regimes. Now, this is an interesting study which compared prednisone with hydrocortisone to look at the effect of these on the growth. So this was a study which was done in 9 children, and they were, some of them were on early on hydrocortisone and shifted to prednisone. And what you could see is that the growth velocity was decreased with the use of prednisone, and roughly growth separation potency. If you compare prednisone versus hydrocortisone, you find that there's a 15:1 difference in terms of using prednisone versus hydrocortisone. This is an important issue which is often there, because when we're using prednisone is often preferred because of the fact that it is easily available at a much cheaper cost, and hydrocortisone, there is often a problem in availability, at least in India. I'm not sure how it is in the other countries. And some of the other trials have also suggested that some of the newer derivatives of prednisone, like deflazacort, have a lesser effect on growth suppression. This is a study which was published in the Journal of Dermatology, and however, this probably needs to be assessed on. I mean, the effects on growth have not been studied to a large extent. This is an area which requires further study. Now, looking at the effect on, we said that we have a blunting of growth hormone secretion, and does replacement of growth hormone bring about an improvement in the growth velocity in these children? This is something which was studied in this article, which was published quite some time back, and they studied 83 children who were on chronic glucocorticoid therapy, and they were receiving growth hormone for at least 12 months of therapy, and at a dose of 0.29 milligrams per kg per week. And the growth velocity increased to 6.3 plus or minus 2.6 centimeters per year, and height ST score improved. It was concluded the growth suppressing effect of glucocorticoids are counterbalanced by the growth hormone therapy. The mean response is that there was a almost doubling of the growth velocity in these children. So, and it also depends on the dose that is being used. Now, the other aspect is that these effects on growth persist even after stopping the glucocorticoids. They persist for quite some time, and this is one study which was looking at the use of prednisone in children who were treated for cystic fibrosis. And there were about 224 children who were studied, and what was seen was that these children were receiving either alternate day or prednisone or placebo. The mean height after age 18 was significantly lower in boys who received either high or low dose prednisone versus those who received placebo. And this effect was most pronounced in boys who started taking prednisone at an earlier age, at between 6 to 8 years of age. And in contrast, there was no persistent growth impairment in girls who were treated similarly. So this is something interesting here that shows that the effects persist for a long period of time. And is there any evidence with inhaled glucocorticoids? Because we have, I mean, a lot of children who need inhaled glucocorticoids for treatment of asthma, bronchial asthma. And if you look at that, what we see is that this was a meta-analysis of 6 different studies, which randomized almost about 1,200 children aged between 4 to 12 years with mild to moderate persistent asthma, and what they found was that fluticasone when they compared fluticasone with dexamethasone, and this study showed that fluticasone given at an equivalent dose was associated with significant greater effect on linear growth velocity as compared to dexamethasone. And there were other trials. There were 3 trials which compared fluticasone with budesonide, and this again had a greater effect than budesonide. Fluticasone therefore has a much greater effect than the other inhaled steroids. Now, the effect on puberty is also has been studied in some of the different series have looked at the effect of glucocorticoids on the pubertal development, and this is mainly caused by decreased GnRH secretion at the level of the hypothalamus, and also the pituitary gland. There is again decreased responsiveness to GnRH with lower LH and FSH levels, and even at the level of the gonads, there is a modulation at the level of the gonads causing decreased steroidogenesis and gametogenesis. So this has been studied in series of children with Cushing's, where these aspects have been studied, and it was shown that there was impaired HPG axis activation, and prepubertal children showed signs of virilization. And iatrogenic Cushing syndrome has also been described in a single case here. A 19-year-old male patient who was receiving dexamethasone nasal drops also developed features of iatrogenic Cushing's with growth retardation, osteoporosis, and hypertension. And this child also had a delay in puberty, and after discontinuing the intranasal use of dexamethasone and adjusting those and putting him on a sort of tapering dose of hydrocortisone over 3.5 months, a normalization of endocrine function was noted, and with onset of puberty and normal pubertal development. So what I would like to end here with the following messages: that exogenous glucocorticoids have an inhibitory effect on growth and puberty. The risk of growth failure depends on the dose, duration, and potency of steroids, and lower potency agents, particularly hydrocortisone, should be used in children wherever possible for the shortest period of time, so as to minimize the effects on growth and puberty. With that, I will conclude. Thank you.